When you open a pipe up like this and it's completely corroded down to this little hole of crap that has filled it, and half of that stuff is like radioactive elements. 170 million Americans are drinking radioactive water, plus arsenic, forever chemicals, and medications are in there. And that's across the entire United States that we see pipes like that. People are never going to drink that water ever again from the tap without cleaning it out, because that's one of the big things that are bringing new toxins into our body, creating this chronic illness.
Hi, and welcome to the Lyme Bites podcast, where we shine a light on the misunderstood science of Lyme and other vector-borne diseases, as well as the truths that many still miss. I'm Dr. Mariah Hinchy, naturopathic physician and fellow of the Medical Academy of Pediatric Special Needs. I specialize in treating chronic Lyme disease as well as other complex inflammatory conditions. In this podcast, we break down what's working and what's not. We share the facts that most people miss, we challenge outdated thinking, and we give both patients and practitioners the tools to heal smarter. So let's get into it and change the way we heal Lyme. Welcome back to Lyme Bites, rebuilding immunity, reversing inflammation, and redefining recovery. Today, I'm joined by Dr. Jaban Moore, who helps clients around the world heal from chronic illness by identifying and addressing root causes such as Lyme, parasites, gut dysfunction, and toxic burden through his True Healing Strategies programs. In this conversation, we'll explore how unresolved infections, environmental toxins, and microbiome disruption can keep the body stuck in chronic inflammation and what it takes to support true healing and recovery. Welcome, Dr. Jaban. Thanks for joining me.
Well, thanks for having me. I'm really excited to have this conversation with you. I know we met just a few months ago at a conference, and I think we have a lot in common.
I think we do too. And you want to know, it's funny. It seems like it was just a few months ago, but it was like well over a year ago.
Life keeps flying by. Maybe that's part of what we'll talk about today is the speed of how everyone's living and how that affects your ability to actually get well.
Yeah, absolutely. So there's a huge conversation around chronic illness right now. What do you think most protocols are missing?
A huge miss is the fact that they're just out there trying to wipe out and eradicate whatever the thing is. If it's Lyme disease, we're hammering antibiotics. If it's heavy metals like mercury, we are driving chelation. If it's parasites, just take a ton of ivermectin. And this is what everyone's doing. You can even go to the other side of it. Oh, just take a few more peptides. And we're missing the fact that the body is an intricate and complex system that you have to regulate. Yes, the immune system, and you've got to make sure it's there and viable. To do that, your body has to feel safe. When it's not safe, when it is worried from running from the tiger, is what a lot of people say, right? If you're running away from something, whether that's the air in your home, the trauma in your childhood, or the lack of nutrients that you're putting into your diet, because maybe you're too sick to eat enough, or maybe you're not eating a healthy diet. All of these are stressors that put your body into the state of feeling unsafe. So if we're not looking at the body and just asking that question from the perspective of all things that could potentially burden us, then I don't care how much of that eradicator chelator you're taking, how much detox you're doing, how many times you're sitting in the sauna, how many EBUs you're doing, you're not going to be able to overcome it for a lot of people. And that's why you've got these doctor hoppers that are going from one doc to the next to the next. And honestly, they come into my clinic and I'm like, what have you done? And they've done everything. I'm like, you've done so many good things. There's been moments where I'm thinking to myself, like, what am I going to do differently? Now, that's before I usually get into the asking them a lot of questions. And this is when I'm reviewing their paperwork before an appointment. And I'm just making sure that I have a good line of questioning to bring up to them, because it's not a lack of information today that a person can get to. It's not a lack of opportunity that many people have. And, I mean, yes, it's expensive to get care. So some people, there's a lack of opportunity, but even the people with unlimited opportunity, those people still are struggling to get well when there's no blockade for finances or travel, because we aren't taking the body as a whole picture. And we're looking at people as if they have an unlimited resources within to do anything and everything we want them to do.
Yeah. So, what do you think is that stumbling block to healing? Like, if you have patients, who they've done all of the bells and whistles, they've done all of the detoxes, they've done gut healing protocols, they're on binders, they've done psychotherapy, they've done physical therapy, they've done all of the right things, but yet they still haven't gotten any better, or worse, they continue to get sicker. What is the issue? What's really going on? Are you ready to revolutionize your approach to diagnosing and healing complex chronic inflammatory illnesses in both adults and children? The Lyme Bites Symposium is your gateway to cutting edge education, groundbreaking research, and innovative therapeutic solutions. Join us at Lyme Bites Symposium at the Fort Lauderdale Marriott, Pompano Beach Resort and Spa. Lyme Bites is the premier functional medicine conference on complex, chronic, infection-driven inflammatory illnesses. This year's meeting is jam-packed with leading industry experts discussing long COVID, mycotoxin illness, PANDAS, as well as Lyme and other vector-borne diseases. This conference will arm you with the knowledge, clinical pearls, and practical solutions that you can implement immediately into your practice Monday morning that will literally change your patients' lives and get them on their path to true healing. So join us at Pompano Beach or virtually from anywhere. Register now at lymebites.com. That's LYMEBYTES.com.
Well, let me take you down the journey of a client that came in. And for the sake of today, I'm going to call this client Erin. So Erin comes in and she is a person that's pretty educated as a client. She's not a doctor, and she had unlimited resources, and she had been to 20 doctors. This is really, really common for me. And as she came in, she had been dealing with fatigue and brain fog, and there had been some mental health issues that had arose, like depression and anxiety. She didn't have them as a child. She had some body pain, and her digestion was off, and she just was that kind of normal client that we see. There's a little bit of sensitivity to supplements, so there's some reactions there. And when I start interviewing her, going through her paperwork, I was asking questions, and I always go back into the childhood part. And there was a divorce in her childhood and a little bit of what she would consider trauma. It wasn't massively significant as far as someone who says like that was like the turning point in my life. This is just something she didn't even mention until I got a little bit into the weeds with her. She mentioned being a little bit more of the A type person, a little slightly perfectionistic, not OCD. So there's a personality type there that I look for that includes some of those types of personalities. And then she was fine through middle school, through her 30s, and then, 33, 34, things just didn't seem like they were working very well. And I asked her, well, what had happened? And she's like, well, and it's usually like this for a lot of people. I had a kid, I ended up getting divorced, and then I moved into this new house, and I just haven't felt the same since that time period. I mean, that is a story I'm sure you hear all the time, right? And then what we started to get into was it wasn't one thing that led to her getting unwell. There was a little bit of trauma as a child that took some energy from her. So I think of the person a little bit as a bank account. So if you can imagine with me, you got $100 to spend every single day on feeling good. And if you go beyond that, we're now in energy bankruptcy. So if you can imagine this with me, and $50 goes to just living. That's just eating and breathing and digesting and normal things. And that childhood trauma was another $10. So we're at $60. She made it through her 20s, and then in her 30s, she was working. She got a job. That's another $20. Now we're at $80. And then she had a kid, and we're at $85, $90. The divorce was a little bit rough. So we're at $100. That's capacity. Well, then we kept going and still got to work and got sick with a cold, just a normal cold because you got a kid. They bring stuff home. The little germ mongers bring it home to you. It happens to me with my little guy.
Yeah.
And all of this kept happening. And what really starts happening is you start trying to take back control. And that control, because you feel out of control when your body is like this, and you start getting a little more fatigued. So you get a little more perfectionistic because you have to. And then you got sick. So now you're trying to avoid getting sick. So you're trying to stay away from certain situations and you're trying to get more sleep and you're changing your sleep pattern. You're improving your sleep habits. You're improving your diet. You're restricting your diet because you're trying to eat less bad stuff. But that makes you feel a little bit bad about things because you can't do what you want to be doing. So there's a little bit more stress, which creates anxiety. So now we don't feel safe in our environment. We don't feel safe in our bodies. And it could even be a subconscious level because you feel like you're doing the right things. So what I'm getting to is all that starts burdening you. And now that takes energy and we're at $110 a day. Well, what happens? Our hair starts falling out, our skin starts to look a little bit more aged, our hormones start becoming disruptive. Do you know the number of women that have come to my clinic that have perimenopause at 36, so they tell me, or
Right.
they're going into the change of life, they're 39, and I'm going, I'm not a woman, but I'm 39
Yeah.
and I feel great. I'm still going to CrossFit and I'm still able to have a burger if I want to on an occasion. And shoot, I'm not telling you to go do bad things, but you should be able to have a glass of wine with the girls on the porch if you want to. Now, that doesn't mean I'm telling you to do that. It's not good for you, but your body should have the adaptability to handle it. And so as this energy bank account becomes tapped with all the stresses and burdens from your entire life that you haven't unloaded, you get unwell. And that takes me all the way back to what has happened to so many of my clients is they're stuck in this neurotoxic loop. And the neurotoxic loop is they feel unsafe because of the stuff that's happened to them in their life. Maybe they're living in mold. Maybe they're living where a place where it's radioactive water, which by the way, 170 million Americans are drinking radioactive water. This is a topic that I'm trying to bring awareness to. And then you have your potential SIBO infections, H. pylori infections, Lyme disease infections that you can start to accumulate. So you have these things are the toxic part of the loop. The neuro part of the loop is the traumas and the stress and the loss of function that now is stressing you out. And even if you've done this, you've been to all the doctors, you've done all the things, you've educated yourself, you've taken the antibiotics, the antiparasitics, and you're like, I've done it all. I should be better. The problem is the toxic loop part you worked on, but did you ever work on the neuro part that creates the same exact interleukins? That creates the same inflammatory pathway triggers that the toxins did by the stress and the trauma will. So then you killed everything. You didn't do the nervous system part. The nervous system part keeps you feeling sick. So you stop doing the killing and the detoxing. And then, well, the immune system's still suppressed. Well, the toxins and the infections start regrowing because you never kill them all. You never get all the toxins to go away. And
Right.
then you're like, you know what? I never did this. I'm going to go do a yoga retreat and I'm going to start working on limbic. So then you go do your nervous system stuff. But the toxin stuff you avoided because Annie Hopper told you that if you just do DNRS, that you don't have to do that stuff anymore.
Hmm.
So it's this loop of, are you doing both? That's the biggest mistake that people do. And that's what I see. I think I called her Erin. That's what I see Erin do all the time when she comes in my clinic because order of operations and synergistic care from a doctor that pays full attention to all the pieces, not just one of the pieces, is a must.
Yeah, 100%. It's so funny. I've had so many patients come in and like I start talking about detox as part of an encompassing protocol. We need to detox while, we're addressing everything else. And they're like, oh no, I already detoxed. I'm like, "What? Are you dead?" Like,
Mhm.
as long as you are alive, like, you are just from being a live body, you are generating toxins consistently, not to mention the toxins that we are breathing and drinking and eating and toxins from the organisms that are inside of ourselves. So, it's such a good point. And I say this over and over again when I'm lecturing. This isn't linear. We can't heal the gut and then go and detox and then rebuild the mitochondria and then deal with the infections. It's like everything is driving upstream, downstream, sideways. It's like this giant ball of wax. And we have to know all of the components and we have to address them all and melt it simultaneously. Or they all just drive each other in like this crazy spiral.
Yeah. Let me be controversial for a moment because this thought just popped into my head about what you just
Go
said.
for it.
The biggest mistake that medicine ever did that you believe right now is that specialists should have an opinion on your overall health. So if you go to a neurologist, cardiologist, endocrinologist, any of the ologists, and
Uh-huh.
you let them have an opinion over your overall picture without having somebody driving the ship that has an ability to take all of their expertises, which is great and valuable, and then go, this is the actual whole person to give then an opinion on the path forward, you're probably making a mistake. Because if you don't do that, you're going to get stuck in the hamster wheel of, oh, that's not my job. Oh, that's not from me. Oh, that I don't know anything about that. And then they just pass you on instead of somebody going, well, your mental health struggle, anxiety could potentially, yes, use a medication temporarily to stabilize you. That's a possibility. But the inflammation in your body that's triggering C reactive protein might be coming from an infection. Oh, but you went off to the infectious disease doctor who said that it had nothing to do with your mental health issues. But mental health person says you have mental health issues. And then the cardiologist says, well, you have inflammation around your heart. But the infectious disease guy that didn't talk to him says you have Lyme disease. So if you have somebody in the center, I could take all of that data and go, oh, well, Lyme is probably causing Lyme endocarditis that led to a neuroinflammatory response that led to autoimmune encephalitis. Then, if we can, instead of giving you an antidepressant, give you an antihistamine, maybe that will deal with the anxiety while helping to bring down some of the inflammation around your heart, while we still can go to the infectious guy and we can talk about working on the Lyme disease. That would be a solution that could actually work.
100%. You're so right. But then that person driving the ship has to be someone that actually understands how the body works and how the body's interaction with the environment, right,
Mhm.
actually matters, right? And that we aren't all of these other systems in a box, including our head off somewhere else, that we just farm around to all of these different specialists, right? A lot of times I feel like a general practitioner is literally sitting there like, okay, did you have your mammogram? Did you have your colonoscopy? Did you have this? Did you have that? Oh, you have this symptom, go see that person. Like to your point with Lyme, it's like, okay, well, so they're off to the orthopedic because of their knee pain. They're off to the GI because they have SIBO. They're off to the cardiologist because they have POTS, and then they're off to the psychiatrist because, they have anxiety and they can't sleep. Oh, and they're off for a sleep study. And it's like, really, all you have to do is identify the underlying infections and focus on the whole person. And lo and behold, one targeted treatment could help all of that instead of, what did I name? 7 different doctors, probably 7 to 14 different drugs and therapies, and still the person isn't any better. Are you suffering from Lyme disease or another complex chronic illness and aren't sure who to trust when it comes to herbal supplements? Hi, I'm Dr. Mariah Hinchy, founder of LymeCore Botanicals. As a naturopathic physician specializing in complex chronic infection-driven illnesses, like Lyme disease, I needed herbal medicine I could truly trust. That's why I formulated LymeCore Botanicals, where our herbal tinctures are handcrafted in small batches right here in Connecticut. We use the whole herb, never isolates, to preserve the full spectrum of medicinal compounds. Every single step from sourcing to extraction is done with precision to ensure maximum purity, potency, and consistency. These are the same herbal formulas I use to heal myself and have used for years to help my patients and family members heal too. And now I'm making them available to practitioners and patients everywhere. LymeCore Botanicals, herbal medicine you can trust from a doctor who lives this work. Learn more at LymeCore Botanicals. That's LYMECORE.com.
Exactly. And then as a part of your situation in there, the person that is driving the ship has to realize that the body has a memory to it. And this is where that neurotoxic loop is really important. I try to weave it in so many places because I want people to understand that trauma can absolutely be caused by childhood something that happened. Absolutely. Or an adult situation, right? We have military men coming back that have been through really traumatic situations. However, I oftentimes tell people when they come in, who have gone 90% of the way through my care plan early in my practice. And they were like, hey, doc, I feel great. I have an amazing wife. My kids are happy. I'm still thinking of this guy that came into my clinic. And he was the guy that probably triggered me to realize this is the path that I had to go down to get real results for people. Because he's like, my wife is amazing. My kids are awesome. I love my job. I don't have pain anymore. I have plenty of energy. I'm not fatigued, but I'm still depressed. I just looked at him and I go, why? Like in my head, I didn't ask him the question. I, I just stepped back on myself and I just said, how? Why? What did we miss? And I realized that when you've been stuck in a certain state of health for long enough, this is not a real term that is out there anywhere besides maybe on something I've talked about, but it's almost a autoimmune PTSD situation. His body had been triggered to be overactive for so long from the Lyme and the mold and the parasites we were dealing with that the immune system itself had broken out of I'm responding for a reason and into a perpetuated state that was self driven to continue to have this inflammatory cycle going. And we had to break that cycle that was leading to his mental health challenges. And we had to do this with anti inflammatory herbs. We had to do this with neurofeedback, which is a brain device that helped to retrain the brain waves out of being stuck in this like overreactive state. Because he'd been in fight or flight for so long, his body felt uncomfortable getting out of it. So it kept the immune system revved, it kept the body in this perpetual state. So for people, sometimes it's not just about removing the problem or vacating the moldy home. It's about actually doing the physical therapy to the brain and rehabbing the body, the microbiome, back to a safe or safety state, like where it feels comfortable state to be able to bring you out of where you were.
Right. So, talk to us deeper about the science behind that. How does being stuck in fight or flight physically block your body's ability to detox or to heal and repair?
So I'll let you talk on this a little bit with me as we go, because I know you're an expert at talking to the doctors and you get more in that language. But where I'm going with this is let me just talk about some testing I run. I get a person that comes in, they do a hair tissue mineral test, they do a urine organic acid test, and they do a blood panel. That's a start point for me in many cases. And they come in with a little C reactive protein, which is a liver marker that says, hey, the body's inflamed. That could be coming from a cold you had last week. That could come from chronic Lyme, living in mold. You name the burden. C reactive protein just tells me that something's going on, and it can go up and down pretty rapidly. So that tells me there's inflammation in the body. I go look at red and white blood cells. White blood cells are a little suppressed. That means it's probably been something that's been there chronically. So a lot of times people with mold or with significant fight or flight states are going to have white blood cells depleted. Yes, if you have chronic viruses and other infections, it's going to be like that. But I honestly don't find a chronic Epstein-Barr virus very often by itself. Whereas I can find mold that's triggering things. Epstein-Barr, if everything else is removed, it doesn't. In my practice, I don't see that alone. I
I
just
see the
don't.
same. There's always a reason that it's elevated. Whether
Absolutely.
it's
I'm glad
spike
we're,
protein, mold, vector borne disease, there's something usually suppressing the immune system and it's overgrowing.
yeah. So for me, it's looking for not the virus, a lot of times other things for white blood cells. Something that I've seen a lot of pattern in is if albumin, which is a protein in your body, goes up, one of the only reasons it will go up is dehydration. So if I see it go above 4.6 in your comprehensive metabolic panel, I start going, okay, the body's a little bit stressed. If it goes above 5, it's actually going to pop for most of us on it's above the medical range. And that can mean dehydration, but not because you're not drinking water, because probably everybody listening to your podcast and mine, they know to drink water. And if you don't know what I'm talking about, your bare minimum is probably somewhere around 60 ounces a day, but it's going to be derived based off of your body weight and your activity level and a lot of other numbers. And when albumin goes up, again, it's not dehydration, it's likely a cortisol stress response. So your body's got stuck in fight or flight. It's producing an adrenal hormone, cortisol, that then leads to other hormones like vasopressin changing. And we end up with more mineral salt or sodium, potassium, and even calcium, magnesium being pushed out into urine because your body's trying to upregulate its response to the stress so that you can do more. that's allowing you to be able to go into the fight or flight and get up and have the energy so that you can be able to overcome whatever that is and then go back to normal. For many of us, though, when we're stuck in this, we get there for way too long. I know I was. And that's what I'm seeing in blood. So then I go to your hair test. And in your hair, at first, your minerals go up because your body starts using them. And it's a used pattern. And then it bottoms out because we burnt out of them. So many of these people that have this long term fight or flight state, you mentioned POTS, dysautonomia, when you feel like you're dysregulated from a nervous system perspective and your shoulders are up in your ears right now as you're listening, you're leaning forward and they're pushed together and you're kind of uncomfortable as I'm describing you. A lot of times, these individuals, their sodium and the potassium, especially when you get tired really easily upon physical activity and you just get winded going up the stairs, your sodium potassium has bottomed out and you're no longer up in the active range. It's just like to the bottom. So I look and I see that, and now at this point, by the way, you don't detox. So good luck doing all your chelation. Good luck doing all of your binders and stimulation activities like castor oil pack, because when you don't have sodium potassium, there's little things in your cells called sodium potassium pumps that are required to allow stuff to go in and out in a good way. And I've just seen people, they're locked up. So now we see that your sodium potassium's not well, your albumin's up, your ALT and AST, which is your liver markers, are going to be sometimes they'll go up for a while, but if they start getting more low, if they're in the single digits, your liver's not going to keep up with us trying to detox. Then we get into your organic acid test, which is probably my favorite test right now. And I run that through Great Plains Laboratory. And I've,
Now Mosaic for everyone listening.
yeah, Mosaic, I forget.
I know.
And I love theirs because I first go to their creatine marker, which is also in your comprehensive metabolic panel. And I look at that and I see if that's below 100, you're probably not the best detoxer. That doesn't mean that your detox markers like glutathione or methylation or ammonia are off, but it tells me that likely we're just not putting out a lot of particulates into our urine. If it's below 50, I'm really concerned because now I don't think that much any of our detox testing is going to be accurate. But let's say we're in the good, 100 to 200 range on that. And I start seeing your Krebs cycle or your ketone fatty acid oxidation cycles are off. If I see markers out of range over 2 markers in those sections, and there's about 20 markers if you total it all up, if I see more than 2, I start thinking cell danger response. And cell danger response means your mitochondria, the powerhouse of your cells. And I'm doing quotations because that's what we talk about it in
What
middle
we
school.
learn, and I was gonna say in elementary school science.
And then you go into your doctoral program and they're like, oh yeah, by the way, it also regulates your hormones and your immune system and your fight or flight responding. So when you're in cell danger response, your body does this. I'm going to, before cell danger response, I'm going to look at an infection. I'm going to look at a toxin. I'm going to think, okay, is this thing good or bad for me? I'm going to dial up the proper response. If it's pollen, I'm going to give you some postnasal drip. That's fine. Whatever. It's something we don't really care that much about. If it's mold, I might cause a little inflammation, tell you to leave the area. If it's an infection, I'm going to send out the body. We're going to try to fight off that bacterial infection. If you're cell danger response, I'm going to send out every single cytokine mast cell degranulation that I possibly can have happen all in one moment. So your body will shut down and you will get the heck out of there because I don't have the bandwidth to differentiate between good and bad. And that's what cell danger response in its worst case. We call this mast cell SIRS, multiple chemical sensitivities, bedridden clients. And the reason why I'm here is because those people, they don't feel safe. They're stuck in a deep toxic loop. And that's more of the deeper science piece of it. And I'll let you go further because I know you can, versus the people that aren't into the mast cell SIRS state. And they're just more in like I don't feel well, but I have a little bit of energy left in my bank account to use on a day-to-day basis. And when I'm talking to somebody, I'm evaluating that because when you're all the way down that to I react to everything, we've just got to take the burden off you.
Yeah,
And that's why you're not getting
100%.
well. If
Yeah.
you're if you're just like, I don't feel well, but I can tolerate some things. Okay, yeah, maybe that eradication protocol, it might be effective for you, although I don't know that it's my favorite option. You could do a more bare minimum look at it like that.
Yeah. And I mean, to elaborate a little bit, I guess I would say, like, if someone is stuck and can't like resolve, there's three stages of cell danger response. So like if you can't pull out of the second stage and get into kind of like that resolution and that recovery stage, I don't know who I heard explain it to me like this, but it stuck with me. I wish I could give them credit, but I can't. It's like, if we're out living our lives and the tornado siren goes off, right? Like you're gonna go get to like your root cellar, or you're gonna get to the basement, or you're gonna go where you need to go and you're gonna stay there. You don't care about eating, you don't care about sleeping, you don't care about going to your job, you don't care about socializing with your friends. You're like, I am in full on red alert danger mode, and I am going to hide until that siren goes off and it's okay to come back out. That's like resolution phase of cell danger response. And the body, literally, the cells get stuck. They've received this warning that they are under imminent threat. And so they just stop worrying about bringing nutrients in. They stop worrying about pushing toxins out, and they literally just shut down. So when you have somebody come in that's stuck in this cell danger response, and you start trying to put them on all the supplements and all the herbs and do this and that, and all of your protocols that work on like 80% of the people, they don't respond, and they often get sicker and have more sensitive reactions because the body just literally can't accept anything. And I think this goes back to like your point where it's like the trauma pathway, the toxin pathway, the inflammatory pathway, they're all the same sort of pathways. And if we don't get the signal to the body that that tornado alarm has been turned off and it's safe to come out, it doesn't matter what you give to the body, it just continues to perceive the threat. So we have to somehow get that signaling in that the danger is being handled at least, right? So that we can start to have some sort of normalcy and normal function. And so with these people, it's like that's where you have to start with the basics. Like getting salt into the body. We've been brainwashed as a nation to think that salt is bad for us and salt causes all of these issues. And it's like, my God, if you're eating a healthy diet, you're actually not getting enough salt.
Mhm.
So we have to get to like these high quality sea salts and bring sodium into our body so that sodium potassium pump can work, because that can actually play a role in this whole phenomenon too. And then, going from like the very basic trace minerals to looking at the phospholipids and the phospholipid bilayer, right? And like restoring like proper cardiolipin, choline, serine balance, like in the cell membrane and in the mitochondrial membrane, and get enough EPA, DHA, and like all these healthy fats. While, like, from day one, we're figuring out what sort of therapy for the nervous system is going to resonate with that person. And it might be something as simple and as passive as doing like a PEMA or maybe a PEMF mat. If they're not to the place where they're able to do, any of these extravagant brain rewiring programs.
Mm.
What do you
Yeah.
think about all of that?
I think that's well said, because when you get somebody at the full spectrum mitochondrial shutdown, cell danger response, sunlight, water, air, anything can be triggering, because the mast cells are in a position where they will degranulate or they'll cause you to have a reaction with almost no change at all. And it doesn't have to be bad or good. It's just a change, any change. So if you've ever taken your finger and just gone down your arm, right? That leaves a little red spot. If it welts up a little bit, that's more degranulation than what it should be. And if it does any more than that, then hey, we've got a lot of degranulation happening. And that's your whole body. So I've had people come in that a drop of a supplement, a eye movement therapy, which blew my mind, is I had somebody doing red light actually 30 seconds of red light on the back of their neck, Herxheimer reaction. I'm like, well, first of all, that can't be a Herxheimer reaction because you're not going septic from red light. So that's something else. But yes, like I believe that you had a reaction,
Right.
kinda, the first time I heard it. And then after that, I heard it 3, 4, 5 more times. I'm like, it's a thing. Okay. All right. Here we
Yep.
are. This is real. And from different people. And it's mind boggling how disrupted people's bodies are today. And I've gone down these rabbit holes of like, what do we do?
Yeah.
And sometimes it's literally just go outside and stare at a tree because your nervous system is so in fight or flight and you're so all over the place. You're so wound up. That has actually caused someone that I worked with to go outside and look at a tree to have what they felt like was a detox reaction. And I was just like, my goodness. Okay. Then now where we're at. Now, the majority of people aren't there. So can you do other things? Yes, you absolutely can. We can go from staring at a tree to PEMF mats to red light therapies to peptide therapies. We can bring in thymosin alpha and BPC 157 and KPV to help to bring down inflammation, regulate the body. Not always easy to get your hands on. You can do LDN and chromalin and ketotifen, which are medications, which easier to get your hands on, not cheap. And I don't love going straight to pharmaceuticals if I don't need to. So I'd rather go to quercetin, stinging nettle, bromelain, rosemary, even vitamin C to help with inflammation, mast cell regulation, to start stabilizing things. But it's not just herbs or breath work or avoidance. It's all of those things are what's actually going to lead to me being the last doctor you have to see, not just the next doctor you have to see,
Right.
which is always the goal.
Yes. Such an important distinction. So let's get practical. I know you just threw some things out there, but be specific. So what would you do with this patient sitting in front of you that's reacting to everything? They've done a bit of this, they've done a bit of that, they've done all the things actually linearly. Like where do you start? What do you do? What's step number 1?
Yeah. So these people come into my office every single day. And this is the exact path I take them through. And if you were to read my note, like how it populates itself, the prefab population,
Mhm.
it will make a lot of sense to you. The prefab population is going to start with this. It's going to say, are you in a safe environment? And it's going to ask about your hair, not your hair, your air, your air. What are you breathing? Is it radioactive? Does it have mold in it? Are there VOCs? And then it's going to go to food. What are you eating? Are you eating enough food? Are you eating the right kinds of food? Are the food something you're reacting to? What is the hygiene products and cleaning products in your house? Are those toxic? Some of these things are so basic. Everybody's like, yeah, yeah, yeah. But I just had a woman last week who had a radon mitigation in her house. She was dealing with mast cell. Her radon was at 14. It's supposed to be below 3. And because it stopped working, they didn't even know it, right? So I always rehash these things out. Do you have dental issues that we need to work on? 86% of wisdom teeth have cavitations, which are holes that allow for infections to grow. People miss this all the time. Do you have mercury in your mouth? Do you have an implant in your body? Not just breast implants, titanium implants, other implants. I've had people come in where they had joint issues they could not get over, and it was because their body was having an autoimmune reaction to a titanium implant, which is super rare, but it happens. And there's ways to solve that, like using titanium homeopathics to calm the body's immune response to it. So we look at the whole environment, including the people. Do you have parasites in your life that are taking energy from you that are people? Because that can be damaging to you also.
Absolutely.
So we look at the environment. And then I say, okay, if we made the perfect environment, everything was perfect, do you now still feel safe in that environment, knowing that it's safe? And the answer to most of these people, whether it's consciously or subconsciously, is no. So then I say, okay, we got to go into the brain work. And this is being done simultaneously, by the way. It's not one or the other. I'm doing them
Right.
simultaneously.
Right.
We're doing anything from Primal Trust, which is my absolute favorite online brain rehab program, to um, we go from there and we go into neurofeedback. We'll find a practitioner local to you if we can for neurofeedback, and I have them do this. I don't do it the normal way. If I can find somebody that's willing to do this, it's awesome. I'm saying this client's stuck in fight or flight. They're very sensitive. So you can't go full speed ahead, but at some point we need to do like an every day or twice a day implementation of a fight or flight type program that is just calming. So this is not even true neurofeedback. It's more like alpha theta relaxation, more like the twilight between sleep and awake. That will calm the system down. And if you do enough of it, I've actually had people have like burst into tears, remember why they were traumatized, stop being sensitive to food. Like I've had some incredible changes with this really low risk situation
Yeah.
because it's light and calming in a room alone, relaxed. So we've had people do that. Stellate ganglion blocks, which is an injection into your neck of procaine or lidocaine over the vagus nerve area that can help you to reset your nervous system out of the fight or flight temporarily, but it has to be done at the right time with the right doctor.
Can I
Um,
interrupt you? How much
yeah,
success have you seen with that procedure?
it's timing.
Okay.
I've seen it take away 15 or 20% of a mast cell response when step one, which is living in a safe environment, is done. Step two, which is doing active brain physical therapy, which is what I call primal trust, so that when you walk out of the stellate ganglion block, you have tools for if somebody swerves at you in traffic. So it's not something I bring up day one. It's something that I say when tools have been implemented and steps have been taken, now we can go use that. As a part of that safe place section, I do involve some of the peptides and medications if that person's extremely reactive. Sometimes single ingredient tools like acromelin has to be brought in because an herb that has 200 phytonutrients might be more reactions than a medication, and vice versa. Sometimes one or the other works. And I tell people that there's not one of these tools that's going to help calm your system. It's 12 of them. It's a little bit of a lot of them. So you might be on 0.25 of LDN or zero point 0.5 of LDN while you're taking uh, DAO, histamine DAO, the enzyme that breaks down histamines, while doing histamine diet, while doing primal trust, while getting your environment safe. And then finally, you have 20% more bandwidth that you can now do the PEMF mat or take the antimicrobial that you couldn't take before. And then that's the path of the push and pull that we go down until they're back to normal.
Makes a lot of sense. And I think it's really, really important to take these initial steps again, instead of just hammering away at what we think, is the underlying cause.
That's the only way I've been able to see it go through for those really sensitive people. And yeah, it's fun to have somebody come into my clinic where it's like, yeah, here's a parasite cleanse, here's a Lyme cleanse, here's a mold cleanse. 4 or 5 months later, they're well, but there are fewer and fewer of those people coming in than ever before. Pre-COVID, I saw 80% of that in my clinic, and they were easy. We just do those and it was done. Now, that's not what I'm seeing anymore. And people are so much more sensitive and so much more chronic, and the inflammatory responses are just mind-boggling.
Everything has
W
been so much worse since COVID. And I mean, obviously the spike protein and the vaccine injury and all of that plays a role for sure. And then, the fact that like we just constantly are being bombarded with whatever the newest, greatest strain of COVID is. But there's got to be more than that. I don't know if it is, I mean, we all went through a trauma, whether we think we did or not, and God, you have to be living under a rock to not have some level of underlying fear of just being in this world right now. And I don't know if that's what it is, but or if we're just spraying more, but it's like there's people are sicker than I have ever seen them in the 20 years that I have been treating complex chronic illness.
Agreed.
Well, any last words of advice that you'd like to give our listeners, whether that's to the sensitive patient or if it's just general advice to anyone dealing with complex chronic illnesses in general, what would you like to say?
I wanna say the thing that doesn't ever go viral, that nobody wants to hear, that, is the most truthful thing I can say to you. It's never one thing. It is always the combination of all of the burdens your body's under and the systems that your body uses that is going to get you out of being stuck. It's not simple, it's not straightforward, but it is absolutely possible. And we're doing it every single day. So have hope and know that when you get with the right doctor, you're going to be able to systematically approach this to where the burden is being lifted, whether or not you feel it in the first month or 3 months or 5 months, if you're extremely sensitive, the burden is going to be lifted and it's going to be testable because you can see that coming off of you as you go forward. So just keep fighting, keep having hope.
Great words of advice. Can you tell our listeners how they can find you?
I'm all over the place at dr.jaban more. Whether that's my website, my YouTube, Facebook, Instagram, all the places, Dr. Jaban Moore. And we're putting out content every day. Whatever the algorithm lets us show to try and educate and teach people, and then drive them back to our email list and other places where we can give them probably better content than what is on the, allowed in some of those social media platforms where we're doing podcasts like this so we can actually educate. Because I know when I was struggling back, um, almost 15, 20 years ago, there wasn't this much information that was accessible, so I felt lost. I feel like
Yeah.
today people are lost in too much information, so I try to help just boil it down.
Great. Yeah. I love the way that you're able to just break everything down into simplistic concepts and terms. It's so helpful for the average listener, and especially those that are filled with brain fog from having neuroinflammation from all of these infection driven illnesses. Um, Thank you for being here. I really appreciate it.
Thanks for having me.
Absolutely. And to all of you at home, thank you for joining us for another episode of the Lyme Bites podcast. If this was helpful, please share it with a friend or someone you love, because together we all heal stronger. Bye.
If this episode gave you an answer, brought you new insight, or made you think differently, subscribe to the Lyme Bites podcast and share with someone who's ready to take control of their healing journey. And if you can, please leave a review. It helps others to find the show. Thanks for listening, and we'll see you next time.